If you need emergency medical care, treatment in the U.S. is the gold standard. But when it comes to prevention and managing chronic disease, that's another story. We've got big problems. We're overfed and undernourished. We've not only supersized our fast food, but our waistlines as well. The U.S. spends more on prescription drugs than any other country. But in Japan, instead of popping a pill to treat the symptoms, they search for the underlying cause. And it's working. People in Japan live longer than we do. People in Japan weigh less than we do. For years, people in Japan have been drinking a very special water. It's called Kangen water, and now Kangen water is available here in the U.S.
Prior to my life as a physician, I was working on a doctorate in nutrition. I have a bachelor's and a master's degree in nutrition and completed my PhD coursework prior to starting medical school. So my background really began in nutrition. When I entered medical school, I was sort of trained like most allopathic physicians that our job is to diagnose disease and to treat it with medication and surgery when necessary. And so I followed that model for the first few years of practice. I began to turn back towards my nutritional training and trying to help them understand nutrition as well as exercise physiology and activity as a means of helping them improve their health and reverse some of the chronic diseases that I was seeing on a regular basis.
Many processes within our bodies produce free radicals. Free radicals are entities that have lost an electron. They are positively charged. They come from the breakdown of foods, from the breakdown of toxins, and they enter our bloodstream. These free radicals are potentially harmful to cells. They will attach themselves, for example, to the lining cell of an artery. And when they do, they will produce an injury. That injury will create a response in the body trying to heal it. Platelets will come from the blood and try to plug that injury. And in the process of making a clot, in the process of then bringing in scavenger cells to repair the damage, the blood vessel is damaged. That's one of the theories of atherogenesis.
I've been here for over 20 years as a dentist, and prior to that I was a dental hygienist. When I worked as a dental hygienist, I got very interested in nutrition and the nutrition and how it relates to the teeth and how it relates to the person.
I've been asking every patient, most of the patient comes every 3 years or so. So I observe every year carefully, and I tell them your colon becoming very firm and tight and developing more pockets, so you have to change your diet, to my diet. Then they improve year by year. That's at least like 2 years, 3 years later, their colon becomes soft and pliable. Even you have a lot of pockets, diverticulosis, which can create thickening of intestinal, the muscular layers. So this diet and the water can change your body situation.
I tell my patients that we are one big biochemical reaction. Everything that's happening in our body is a biochemical reaction. And for biochemical reactions to occur, we need a solvent. And the solvent in our bodies is water. So there's no question that the most important thing that we can do is hydrate our bodies.
Acid reflux, as you know, is a huge problem in our country. People who are obese tend to have it because their stomach and their gastroesophageal junction gets shoved up into the chest. Their lower esophageal sphincter isn't tight, and the esophagus is squamous epithelium. It's a different lining from the stomach, and it doesn't tolerate acid. So when the valve that connects the stomach to the esophagus, that interconnection doesn't function, the acid suddenly starts bathing this lining of the esophagus in acid, and it can't tolerate it. It's painful. People have that terrible sour taste in their back of their throat.
When we treat chronic disease with medication and we don't really attack the root cause, which is oxidative stress, free radical damage, we're not really treating or curing the disease, we're managing the disease.
Antioxidants